introduce our speaker this morning. Our speaker today is Dr. Emily Huff. She's an assistant professor in the Department of Forestry at Michigan State University. Prior to joining the faculty at MSU, she worked for the USDA Forest Service Northern Research Station as a research forester. Her research studies the effect of human behaviors of forests and the influence of research quality and availability on human decision-making. Last fall, she taught a course at MSU entitled Forest Amenities and Forest Therapy with Dr. Ohara from Tokyo University of Agriculture in Japan, where forest therapy really began in Japan. So please help me in welcoming Dr. Emily Huff.
Hi everyone. Can you hear me okay? Okay, excellent. It's really a pleasure to be here. This is my first foray down here to the Cedar Creek Institute, moving to Michigan. See, it's almost 3 years ago now. So when I worked for the Forest Service, I was just telling Ellen I was actually stationed in Manhattan in New York City. So this has been a huge change for me. This is what happens when you study social forestry. You get put in cities more often than out in the true wilderness. So I'm here today to talk with you about a topic that's fairly new to me as well. So last fall when I taught the course that Ellen mentioned with Dr. Uehara, it was a co-teaching experience where I was learning from him just as much as I was teaching our students at MSU. So it's a topic that seems to have exploded across the country in terms of opportunities and activities and sort of media presence. But I'm here to kind of share with you what I know and what I've learned about the scientific underpinnings of forest therapy and how it's practiced and where it's practiced and those sorts of things. And it's a much shorter talk than an hour, and I've got a couple ideas for points of discussion we can talk about. Happy to answer any questions that I can, but I may have to refer you to other sources if I cannot. So by way of introduction, a little bit more about myself too. Why I'm interested in this topic is largely the intersection, the merging of humans and forest resources. So I'm a human dimension scientist, which means I study the decision-making and policy and governance processes that dictate how humans and forests interact. So forest therapy to me is a really neat way to possibly merge sort of the natural scientific side of forestry with the human well-being and use side of forestry. So I come at it from kind of a scientific perspective, wanting to understand, is this a practice that can lead to positive outcomes in human well-being? But also, my personal bias, I just like being out in the woods. So it's another opportunity to explore that a little bit more. All right, so what is forest therapy? It's actually quite simple. The two words really tell you everything you need to know. It's any kind of therapeutic practice that happens in the forest. So you have probably heard about nature-based therapies. This is really just kind of a microcosm of the broader nature-based therapy topic and all of the scientific research around that topic. Just narrowing down to a forested setting. It could be in an urban forested setting, so a park, or it could be in a more wild, rural urban setting. So it covers anything from simply relaxing in the forest or going for a walk to more intensive therapeutic practices like mindfulness and meditation, whether that's guided or self-taught, or occupational therapy, so working with physical disabilities, other sorts of injuries that benefit from doing some type of movement. And then obviously very formal counseling also falls under this umbrella of forest therapy. Could be individual one-on-one counseling, could be group counseling to treat a variety of conditions. So again, I'm really interested in the understanding of, awareness of, and engagement with forests, improving well-being, and also possibly using forest therapy as a way to protect and conserve forest resources. So if we have a greater need for them from a health perspective, there's a greater likelihood that we'll protect our forest resources. So the sort of the backdrop for why this came to be, and I'll talk a little bit about the history of forest therapy in a minute, we find in the US, and this is sort of paralleled in other countries where forest therapy is practiced more formally, that there's an increasing prevalence of a lot of mental health disorders. There's been research demonstrating an increased prevalence of post-traumatic stress disorder, largely due to the Iraq and Afghanistan war, but obviously there's research that demonstrates that to be the case throughout history with other major conflicts. There's been a lot of research lately too, and this is near and dear to my heart as a faculty member, increased anxiety among college-age students, and in particular, an increase in health-seeking behaviors. So there's a greater level of anxiety and stress, but also a greater level of seeking out help for these issues among college-age students, which for sort of the mental health community that demonstrates an increased demand for mental health therapies and other treatments. Forest therapy is also particularly helpful for physical disabilities and cognitive disabilities, a little bit different than sort of the mental health, thinking about dementia and Alzheimer's, so issues of recall and confusion. I've talked about anxiety disorders, but also the acute manifestations of stress, so high blood pressure, high cholesterol. Forest therapy's also been kind of framed in this recreation and relaxation for urban populations. I think the last statistic I saw was 82% of the US lives in what's classified as an urban area. Some of these are migrants to cities, others have grown up there, and in both cases we're seeing a sort of distancing from nature and from an awareness of natural resources. And sometimes that wildness experience is just really important for people who need a lifestyle reset, reconnecting populations and supporting urban parks and green spaces. So I've mentioned that it helps us protect our forest resources, but it also potentially builds support for green spaces in cities, also for those urban populations. So as Ellen mentioned, the history of forest therapy, if you kind of trace it back to where did it first appear, would be Japan. And there it's called Shinrin-yoku, which literally translates to forest bathing. So sometimes if you Google that, you'll find more information based on that sort of search term. It's sort of first documented in the early 1980s, but what I learned from Dr. Uehara was that it's been practiced since the 50s and 60s. It's just the 1980s where it became kind of formalized. And at the moment, there are over 60 forest therapy camps through all of Japan's prefectures. So it's not just concentrated in and around Tokyo, but it's actually found throughout the country. He was also very keen to point out that in Japan, there's been a distinct divide in the forest therapy and forest bathing community. One sort of path became very commercialized. He was, as you might imagine, not a fan of that, where a couple of companies sort of seized on this idea and are charging upwards of $10,000 to $20,000 American equivalent for a forest bathing therapy program. And sort of saying, this is going to change your life, and for the really stressed out, wealthy Tokyo elite, he wanted to really ensure that I followed the path of a therapeutic practice that's meant for all, and not just for those who can afford it. So if you're exploring this topic further and you see some sort of mentions of forest therapy in that kind of commercial setting, just know that there is that divide in Japan. So one case study that I learned from him that I want to share with you also kind of tracks the early history of forest therapy in Japan, and he referred to them as hospital forests. So this image up in the upper right is in Kagoshima in the south of Japan. And the hospital itself and sort of the connection to the nearby forest was established in the late 80s. The hospital focuses on mental health rehabilitation and sort of general internal medicine, and in particular has a high incidence of patients with dementia and other advanced age mental disabilities. So the hospital focuses on long-term treatment and has a lot of kind of so-called permanent residents. It's not quite like an assisted living facility. It's sort of a hybrid approach. The average age of patients is 81, and it's a pretty small group that was enrolled in this program, about 110 patients. So their goal with the program when they established it was to decrease what they call behavioral and psychological symptoms of dementia and combine the forest therapy practices with other therapies. So they gave patients and their doctors a choice of more than 30 different kinds of therapies. And they were estimating the effects of the therapy across mental, behavioral, and daily life measures. So they came up with ways to measure change in mental, behavioral, and daily life statistics. So what they did in this program is they provided an explanation and sort of a practice guide for their patients. They had the families of the patients agree to let their loved ones participate. 7 to 8 patients per session, once per week for a couple of hours. Dealt with patients that had Alzheimer's, dementia, brain blood circulation issues, manic depression, schizophrenia, and a few others. It began in 2009, and it had a ratio of 1 to 2 patients for 1 staff member. So what they did was trained the staff at the hospital to work with the patients through these different therapeutic practices depending on their condition. They were tailored. And what they found is a decrease in those behavioral psychosymptoms of dementia. It eased fastidiousness, so sort of a lot of the patients expressed this need to kind of control their lives and couldn't sort of relax. And so they found that it eased those symptoms, eased anxiety, and eased excitability among patients. For many for whom walking was a really important rehabilitation task, it gave them motivation to go walking. So instead of walking the hospital halls, they could actually go out to the nearby forests. They found that people stayed in the forest past the 9 to 11:30 treatment time. It stimulated really positive memories, and for the patients who had Alzheimer's, that was a particularly interesting finding. They reconsidered their self-responsibilities and the self-purpose of the therapy. Many of the patients experienced better sleep patterns, better self-expression, and a more positive relationship with medical staff, which actually is, in the end, what led them to formalize the program in the hospital. They had had a lot of issues with patients not responding well to their medical treatment or not getting along with medical staff, and they found that after integrating this practice, that improved quite a bit. It's not without risks. So patients in the woods, there's obviously a risk associated with being out in the woods. You could trip, trees fall, that's a pretty unlikely one, but there was an over-self-estimation of the effects of the therapy, which I'll talk a little bit more about in a moment. And there were a few cases where anxiety and depression got worse. It was not a random clinical trial. This was a small group of patients that were enrolled and agreed to participate, and there was no control to the experiment. So it's hard to attribute those worst cases to one thing or another in this case. So other early research from Japan measuring blood pressure after mindful walking. This was also in 2010. So I'm a scientist, sorry, I tell stories through graphs. So along the bottom, you see kind of a before and after, and a maximum and minimum measurement taken of blood pressure. And they did find a statistically significant difference in blood pressure after mindful walking through the forest. But again, there was no control group for walking not in a forest setting. So I'll talk a little bit about that in a little while. Same thing with what's called salivary amylase, which is one possible measure of stress. There's also cortisol that you can sort of take a swab of within somebody's spit and figure out if stress levels are increasing or decreasing. So they did find a significant decrease in salivary amylase levels after walking. Measuring not sort of those physiological manifestations, but self-reported behavioral or cognitive stuff. They found after 1 hour of self-counseling in the woods using a test of anxiety, depression, anger, fatigue, confusion, and vitality, they found a decrease across sort of the negative affects. So anxiety went down, depression, anger, fatigue, and confusion. And then this light blue line here is the vitality score actually went up at the end of a self-counseling session in the forest. Exploratory research, again, this is not compared to a control of the counseling happening outside of a forest setting. So what I found, I got pretty interested in this while developing the course for my students. So I dove into the scientific literature on the topic and found that all these papers that I've kind of put next to the different outcomes we see with forest therapy are studies that take place across Japan, in Korea, primarily Asian countries. There's been a couple of studies that have occurred here in the US. There are not many where a control, non-nature or non-forest setting is used as a comparison. So it is early exploratory research. Does this have an effect in a forested setting? So bear that in mind, but these are the things that we're starting to see. Decreased feelings of stress and anxiety, increased social behavior, so for folks for whom social interactions are anxiety-provoking, social anxiety seems to decrease, increased levels of concentration, increased energy. We've probably all been in a position where we're having a slog day through work and you get up and you walk around, great. If you get up and you walk around outside, even better. Decreased aggression and irritability, and increased capacity for memory recollection. And these studies kind of span all different age groups, older to younger, a variety of socioeconomic status and gender as well. So those factors do not seem to contribute to the outcomes that we're seeing. So this is a bit hard to see. Many of you have probably accessed this website before, but just in case, it's www.natureandforesttherapy.org. So there's actually a place to go. There's an association for all of these activities around the US. When I looked at this even 4 years ago, there was not much, and this website has just exploded in the past couple of years. So too have references to these kinds of programs in the news. I want to point out Minnesota in particular because it's one of the few places that I'm aware of where you can actually get your insurance to pay for this type of program. It's a long and lengthy, arduous process, and not all insurance companies will do this, but for whatever reason, Minnesota seems to be at the forefront of this type of thing. Not just that, but on that website, natureandforesttherapy.org, there's a worldwide forest therapy guide locator map. Yeah, I was totally shocked to see this, because when I offered to teach the course, this did not exist, not that long ago. So I zoomed in on Michigan, and I did know actually the 4 folks that have been trained via this Association of Nature and Forest Therapy. So all this locator does is tell you who all these little dots are people that have been trained by the association to deliver forest and nature-based therapy programs. It's not a formal certification. This is obviously not, akin to a medical degree, but they're all have gone through kind of a similar curriculum, similar outlook, are aware of best practices and research and that type of thing. So I think Ellen had mentioned that she's actually been in touch with the woman in Ann Arbor who does actually run programs down there for folks in that area. So practically speaking, that was sort of some of the science behind all of this. What does it actually look like in a general context? So not from a personal perspective, but if we were to implement a program, whether it's for research or for practice or for both. The first is you have to know who your clients are. So are you looking to address mental health issues, physical disabilities, and if so, what's the baseline of the people you're working with? We always are looking for a before and after. Does this therapy lead to positive change across physical, mental, or social conditions? It's also kind of neat to do an assessment of the forest you want to work in. So for a forester, this could be tree species, what's on the floor, what's the soil type, geography, what animals are present. From a practical perspective, all of that boils down to what kind of wildness and nature are we doing these therapies in? Are we dealing with clients who don't want to get their butts dirty or who don't want to put on hiking shoes? Are we dealing in an urban park setting? Do we have people with allergies? We don't want certain tree species in our forest therapy setting. So on campus, training the students, we walked through all different levels of kind of forest wildness and forest characteristics to think about what are some of the best spaces for these therapy programs. Not all forests are created equal. Thinking about what you're actually going to do. Are you just walking? Are you engaging in some kind of formal counseling? That also affects the site that you choose. We found that even on the campus of Michigan State, where it's fairly quiet, so to speak, there's still a lot of noise, background noise, so selecting a site is pretty tricky. All of the logistics, so we've talked about forest type, time, distance, how long does it take people to get to the sites, how many people are in a program, how frequently do you need to do a program like this to see benefits. Some of these are open questions, some you can get answers to, more or less. And then what happens at the end? Do people change? So based on the information you collected at the beginning, do you see some kind of a positive change? If not, what do we do? Should we change course? Do we redesign the program, etc.? From a personal perspective, so that's kind of thinking about how you would do a program. From a personal perspective, you can be as informal or as formal with this as you'd like. So choosing your practice, or what are you most interested in? Are you most interested in physical wellness type effects? Are you most interested in the mental health effects of a forest therapy practice? There's a really neat, I just learned about this actually on a recent trip to Ontario, a 30 by 30 challenge. So a foundation in partnership with the ministry in Ontario challenges you to spend 30 minutes a day in nature for 30 days to kickstart what they hope will become a habit for people. And they've concentrated that effort on the GTA, the Greater Toronto area. So a lot of these settings are more urban park-like than rural forest, but that's just where the majority of the population lives. You can also work with some of the licensed professionals, like I showed you on the previous map, to offer therapies in natural settings, or to consider whether or not health professionals that you already work with have the ability or the capacity to work with you to develop a forest-based therapy program. Or you become your own guide, that's another option. So, we've talked about all sort of the good things in my mind of this type of practice. What are some of the barriers? So I alluded to one, giving the Minnesota example, and I think it's really the biggest one in the US, is insurance. So we've learned that almost without exception, mental health practitioners in particular cannot get insurance if they leave the walls of their building. So if they take you outside, their insurance is immediately voided. So if you tried, you could basically sue them for just about anything once you walk out the door of their building. So that's a major issue. And to overcome that issue, what I've learned talking to folks at the National Institute of Health is that we really need evidence from a randomized controlled clinical trial. So there's been 2 reviews of all the scientific literature, some of which I presented on that slide. So one in 2012 concluded, as I mentioned, that what we have is a lack of control groups. So we kind of know it works from the people who engage in the practice. We just don't know if it works more than doing any of those things in a non-forest setting or a non-nature setting. Any one of us in this room might think to ourselves or know anecdotally, but what we lack is that evidence that it works more than the same practice in a non-forest setting. And for what particular conditions. It may not work across all conditions. And then again in 2017, a group of intrepid scholars tried this again and found that there had been enough research since 2012 to find positive health effects from spending time in forests. That much we know. But there's still not enough evidence for any kind of practical guidance about how to do this. So some of the things I was talking about, considerations of how long, how green is enough, those types of questions are not conclusively answered to the point where recommendations can come out and insurance companies can say, okay, the benefits of this outweigh the risks and therefore we will insure people to go outside into the woods and engage in these therapies. Another barrier, which I'm now learning, is that some find forest settings unpleasant, actually, or anxiety-provoking. So working with a group of young adults from Detroit, many of whom actually even volunteer for tree planting efforts through Greening of Detroit, have commented that being in a forest would make them really stressed out, and they do not understand why forest therapy would lead to less stress for them. So it's important to know what somebody's values and experiences and attitudes are before thinking about that as a therapy choice. And then another really big one is not knowing what natural setting is best. So I've talked about urban parks, which could be one tree with a bench underneath it, to the beautiful forests of the Cedar Creek Institute. So not knowing what's kind of enough to get those nature and forest therapeutic effects is a major barrier. If we knew that one tree were enough, or some percentage of green versus black and brown, then it would help guide some of the evidence that, say, insurance companies might need to come on board. And then I also mentioned at the beginning, there's this whole broad literature about nature-based therapy. And so understanding if forests are any different than, say, a view shed with water in it, or sitting in the middle of the desert, does that have the same therapeutic effect? So I've talked a lot about forest-based therapy, but it's really nested in this broader topic of nature-based therapy. All right, so what have I done since, well, in the last few years and since kind of getting involved in this topic? In addition to teaching it as a standalone topic, I've also experimented with implementing the therapies in 2 classes. We've talked about the rise in anxiety and stress among college students, so why not work with that population? So there were 2 classes. One was called Intro to Community Sustainability, and one was a really unique offering that I hope will be permanent, but it was sort of an experiment last fall, was a class that covered mindfulness practices around the world. So we talked about the methodological issues, so bear in mind, these are students who are interested in environmentalism, sustainability, and mindfulness. These are not the skeptics who participated in these classes. That's okay though. I had our students who took the forest therapy class actually design the forest therapy practices, so it was a peer learning model, peers teaching other peers. We did I repeated the same thing in the 2 classes, and we did 4 different therapies. So they were about an hour and a half each class, and the students rotated through 4 options to see if we could capture something that would appeal to the variety of needs and wants of the students. So first we had them take their journals and find something in the woods that inspired them. They could write about it, they could draw it, they could just sit there and do nothing, whatever. Look for inspiration. The second practice was mindful walking. So we had them walk really slowly, which for most students, that in and of itself was a crazy new experience, just how slowly they had to walk. And also to either concentrate on one thought the whole time, or do their best to empty their minds. For some students that was a lot easier than others. The third practice was art therapy. So we brought them paper and paint, and these 2 images here are our peer leader there teaching the students kind of to let go and just be artistic and express their art. And then the final was a group counseling session. So we are fortunate enough in the university to find ways around some of the insurance issues. So we had a counselor from the student health center come out and do a short counseling session with students, asking them very simple questions. Are you stressed out? What are you stressed out about? Basically a bunch of questions revolving around the topic of stress and anxiety. So my role in the whole thing was to administer a pre and post survey after the short little 1.5 hour. And found that asking students about their stress level, in the following slides, the brown's going to be pre and the red orange is going to be post test. We found that stress did kind of shift from very stressed, extremely stressed to the right over towards somewhat stressed, not stressed after the experience. Energy levels, so shifting from extremely low, very low, somewhat low in the brown. You can see the kind of curve of the data shifts to the right towards average, somewhat high energy levels. Relaxation levels also kind of shifted afterwards from very tense, somewhat tense to more relaxed, very relaxed, somewhat relaxed. and mood. So we asked if you were angry, depressed, nervous, calm, happy, or indifferent. So it's kind of arranged on a scale, and then there are different moods and emotions. Shifted more towards calm and content. And a lot of the kind of qualitative information, we asked people to just free write about their experiences. They found that taking that time and having the structure to say to themselves, this is just my time to not worry about homework and tests and social stuff, was really helpful. Some of the negative comments, not surprisingly, it's freaking cold out here, I didn't wear the right shoes, I forgot water. So that sort of speaks to those practical logistics about implementing therapy programs. So what's happening for me next? Right now, I'm in the process of preparing a proposal for that randomized controlled clinical trial. So I'm really interested, and this will just be a feasibility, so is this going to work at all? How do we do this? How do we find the right control groups? What disorders do we choose? How do we design these programs? So one thing I'll ask of all of you, if anyone in this room has experienced anxiety, depression, PTSD, or if you know others who do, right now we're in the stages of just simply interviewing folks to understand all the different ways in which this could fail or could go well. These are things we'll need to know if we're going to kind of carry this forward, all with the goal, as I mentioned, of starting to generate that evidence to say, where does this work, how does it work, when does it work, to enable it to become a standardized practice that's covered under insurance. That's sort of the overall goal. Not paying any attention to the politics of insurance. Let's just assume for now health insurance is here to stay. So I will stop there. I put up 3 different points for discussion, but I'm obviously happy to answer any random questions as well. And thank you all for being here and listening. Yeah?
Not exactly random, but it's not what I'm saying. But most sources suggest lots of variables and factors in the anxiety levels among young people. But it seems that this soaring rate has sort of coincided with literature related to like nature deficit disorder and last child left indoors and that kind of thing. I'm wondering if in your work you've ever come across anything speaking to not just an anxious young person seeing improvement by being put in nature, but whether being in nature more growing up staves off developing anxiety disorders.
Yeah, that's an excellent question. So thinking about the design of a trial, a clinical trial, we probably account for your level of exposure in childhood, early adulthood, etc. So kind of speaking to that, some people might find forest anxiety provoking if they've had no exposure to it. We're going to want to control for exposure to forests and forest settings growing up. By doing that, we lose some of that interesting information about whether that in and of itself is a factor influencing your
Non-development of it?
Yeah, right, whether it's preventative for anxiety and depression. But I think depending how we design the experiment, we could capture some of that along the way.
Have you ever seen any work on that?
I haven't. I have not.
Anecdotally, I think if I had not been outside a lot, by 18 I probably would have been floated, but anyway.
Yeah. Well, and right, it's probably very correlated with developing other positive lifestyle choices and behaviors. So that'd be the tricky part to disentangle. What does exposure to forests cause this, which then causes that, or is simply being in it and around it prevent onset of anxiety?
Thank you.
Yeah.
Just a couple questions tying into your Japanese peer. Do they have empirical studies, since they've been doing it longer in Japan, that could in any way, correlate for your studies?
Yeah, so all of the work there has been targeted as opposed to random and controlled. So they've picked I call it opportunistic populations that they have access to easily or readily. So in the case of the hospital patients, they have patients who are experiencing those conditions who are enrolled in the program, but then the studies don't have a group that's experiencing those conditions and not enrolled in the program. So all of the scientific literature in Japan has shown early evidence, but hasn't kind of gotten to that point of having the control group. So that's one of the reasons that having Dr. Uehara out here, we came up with this, okay, what do we need to move forward in this field? It's this next step. There is plenty of experimental data on the effects of the therapies themselves. So some of the ones I showed, increasing cortisol and celery amylase and decreasing blood pressure, people improving their scores on various measures within physical therapy programs and such, but not any that then have a control to a population that didn't go through the therapy program, but had the same, exact characteristics of your experimental group.
And then just personally, what was your greatest takeaway working with him and learning from him? Personally, what was your greatest takeaway that would influence you in forest use?
Yeah, so a couple. One was the culture and societal expectations around nature and forest therapy and engagement. Here, I'll just put this out there, it's often viewed as a fringe or an alternative approach to well-being and health, whereas there, my impression is it's viewed as a very normal, culturally accepted practice. So that was one takeaway. The other, I think, was how much intention goes into creating forest settings in the practice of Shinrin-yoku. So in my mind, forest therapy, there it is, the forest, go do your therapy. And in his mind, he would spend hours, if not weeks, preparing forest sites for the different therapies he would workshop and he would teach. So he would, if it were group counseling, he would go and actually what he would do is he'd have his physical disability patients come with him and do manual labor to prepare the site for his group counseling sessions. They would cut logs for people to sit on, they would clear areas, they would create an aesthetic that he desired for his workshop. So that was a striking takeaway for me. Yeah, exactly. Feng Shui. Yeah.
Are you familiar with the mini forest?
No.
There was a young man, I think he might have been Japanese, who developed the concept of in a backyard, maybe taking 100 square feet, and apparently densely planting it so that it was a forest. And then even that had an impact. I've seen a number of articles on that. And so I wanted your advice on how to do that in my day.
Well, I can certainly tell you how to get a mini forest going. Whether it's in a way that promotes well-being, I don't know. You might have more frustration than we were just talking about deer browse and all these other things. But yeah, no, and I think I was recently in June at a conference with all this really cool scientific research about being in the soil and all the positive health effects of various bacteria and other things that we're kind of passively ingesting when we play in soil and garden and farm and plant trees or whatever we're doing. So there's some really interesting synergies there too, that we've got this kind of, it's coming at us from all sides when we're out working in the woods or being in the woods, that there's possible like physical movement benefits, there's possible bacterial kind of ingestion benefits, there's cognitive psychological benefits, so it'll be really tricky to separate all of those, but potentially pretty cool too. But no, I don't know how to look into that. Yeah?
Not to hug. But the third one, how formal or informal, I think that's really interesting because you've touched on so many things like PTSD and those who feel anxious in the woods. I just flashed back to when I was in my 20s, I volunteered in a sexual assault program and went to like a statewide workshop. And somebody, I felt rather informally, did a guided visualization exercise, and someone in the room had a very serious experience. And there were some MSWs and some folks to work with that person. But I would think it would vary a lot, the formality of it, on what the diagnosis is, and like who you have available and how structured it is, right?
Yeah, and I wonder too, I mean, my husband is an Army veteran with PTSD, and he talks about desire for treatment, self-desire for treatment. So that's one thing we're grappling with in this kind of feasibility work is if you have no desire to get better, it doesn't matter if the therapy takes place in a forest or not. So there's some kind of, you're absolutely right that the level of what you're dealing with will greatly depend on how effective the therapy is, but probably the biggest one is your desire to even be in a program at all.
And how much protection you offer, right?
Yeah, absolutely.
You know, years ago, we used to have trees planted along our streets in that green space between the sidewalk and the streets. And then as they started widening streets, they took that away. And thus it feels less safe for people to walk or bike as pedestrians down the sidewalks. And that was kind of protect the cars from getting broken when they ran into trees. But it doesn't make it safe for the pedestrians, which felt more comfort. So today we're understanding that, like in Cleveland, I guess many, many decades ago, there are sections of town where they removed all the trees and the violence increased. And that if you put the trees back, the violence decreases and people have more happiness. Plus they're out there enjoying that experience. So there's so much to be considered in bringing nature back into the daily lives of people.
Oh, urban forestry and tree management is a minefield. There's also studies that show increased levels of violence in parks because there are places to hide and do all sorts of various things. So it is, I've not even scratched the surface of all the really interesting social ramifications of trees in urban areas, but I like that notion that actually that kind of buffer strip of trees between streets and pedestrians has some other, I often just think about it from a risk, cost, benefit perspective. You know, trees drop all sorts of things, you have to clean them up, cities don't want to pay for it, but they provide shade, and
It never was a problem when I was a kid. I didn't trip over a walnut.
I think I saw a hand over here somewhere. Yeah.
After World War I, Monet, the painter, saw people coming back from the Great War. And what then was called shell shock, today is called PTSD. And he planted the gardens, the water lilies that are so famous, both before and after he started losing his own vision. But those gardens were planted, manicured, to give therapy to shell shock veterans coming back from the wars in Europe, so that they could have serenity. And it truly, truly worked beautifully. And that's way before the 80s. And I'm thinking, I think you said about 1980 when this stuff started in Japan. To think about the timeline, the people who were alive, lived through and survived Hiroshima, are now, in that period in the 80s, mature adults, even though they were teenagers and very impressionable when those bombs fell. And they now are having the PTSD from World War II that their grandparents had after World War I. And that is possibly a part of the immersion in forced bathing throughout Japan, the fact that these people have nowhere else to turn. Because feeling assaulted on all sides by that type of trauma and destruction, nothing was safe.
Yeah.
And going back to the forest is away from all of everything from E equals MC squared to the context of cradling Mother Nature. And that would explain a lot of the Zen and walking meditation that came out of that period in the 80s and 90s.
Yeah, that's a really excellent point. Thank you for bringing it up. That Dr. Uehara's perspective on why the 80s, why did it become more formal and part of the conversation. he felt like the bedrock had been laid more religiously and culturally speaking, that there's always been an emphasis in Japanese culture on sort of the Zen and mindfulness approach to healing oneself inside and out. But then he believed it, as you mentioned, it was a byproduct of several very impactful wars on the country that led people to seek therapies in different and unique ways.
In the same period is the time of the Holocaust survivors, because when you've experienced something as totally upside down world as surviving Auschwitz, Treblinka, etc., you simply walk away and close the door, and then there's a new life. And it's easy to close that door when you're 15, 20, 30, but all of a sudden you're 60, 70, 80, and that door starts pop open because the padlock doesn't work as well as it used to. And so during that same period in Western culture, extreme explosion of a lot of talk therapy and processing the stuff that happened 40, 50 years ago when we could still shut the doors and get on with life. But now there's no filter. And so it took a new paradigm of therapy to process that for the people who were devoid of all hope. And in Japan, the country was devastated. There were no rabbits running around because everything was eaten that could be eaten. Consequently, going back to find the little mousy rabbit. And I will say one more thing. Christopher Robin, A.A. Milne wrote the Christopher Robin books in response to his own PTSD. And in one reading, it was because the flies in the forest reminded him of bullets whizzing by. And yet, in one of the stories, it was because the flies reminded him of bot flies, and he knew that the bot flies had been eating. Yeah, that's PTSD.
Talk about that's forest therapy provoking anxiety.
Well, I'm Vietnam era, and it was very evident that when guys came back from Vietnam, a lot of them had obviously PTSD, and there wasn't a lot of therapy available for them at that time. I really didn't even recognize it. And if anybody remembers the large movement in the Northwest, there was a huge concentration of Vietnam veterans that moved out into the forest. To me, that's just like self-therapy. They couldn't get anywhere else. They knew what they needed, and they just gravitated toward it. And some of those guys are still living out there. I had another interesting personal experience. In the 80s, we had an African-American friend who knew a single mom. She had a couple of sons, and they were, I would say, 9 and 11, I'm going to guess, trying to think back. And he wanted to take them out. These kids had never seen anything but concrete and asphalt, and this is in Kalamazoo. So it wasn't that urban, you know, I mean, they had trees and stuff. But he wanted to get them out, so we took them on the southwest side of Kalamazoo, there's Sugarloaf Lake, and there's a little island out there that he was aware of. So we kind of put a lot of stress on these kids because he wanted to get them away from the land, so we actually put them in canoes and took them across the lake, which was asking a lot of them, and they were terrified. They thought there were sharks in the lake, for starters. We had to get past that. And then the minute we got, and he wanted us to go because he wanted more help with the kids, you know, supervising, which was well thought out on his part. But we got ashore, and the minute we hit the land, the kids ran out of the canoe, literally grabbed the first thing that looked like a weapon, which was a stick, and before we could stop them, they had probably wiped out 6 or 8 little saplings. So it was like they were trying to conquer their environment. It was very interesting the way we did an overnighter, which was good. I'm glad we didn't make them go 2 nights, but we did an overnighter. And they slowly started to calm down and accept their environment. We had to do a lot of things like s'mores and stuff like that to, you know, literally make it seem more like home and positive reinforcement for them. But they were really scared. I think they came out of it over time, but they were still ready to go home. But it was kind of an eye-opener for me to watch the effect. And I also was wondering about have there been any really far-ranging studies on the effects of us just living in an urban environment and the more devoid it is of vegetation? Has there been a lot of really good casework done on that? Because I think we need to look at that 99% in our urban planning and planning in general. Like, to me, I really hate sprawl, and I just think that's destroying our ability to have any kind of really good one-on-one with nature, because we're like those two kids. We're trying to conquer nature, which I think is so sad. I much prefer us to live in compact urban areas with a lot of access out into the forest, which is kind of a science fiction approach in a lot of urban plannings, if a lot of stuff you read. But we just seem to be diametrically opposed to doing that.
Yeah, but there's been a long history too of what stewardship means and how nature is meant to be managed and tamed, and there's sort of the debate about wildness versus managed nature, for lack of a better phrase. Is everyone good with causation versus correlation? So things can be related to each other and move in similar directions, but one might not cause the other. So I'll say that to answer your question, there's been a lot of good correlation-based research that the more urban the environment, the less green there is, all sorts of negative consequences for behavior and various measures of well-being, physical and mental. But it's pretty hard to control for people's level of exposure. How often are they leaving the city? A lot of it is self-reported data, or it's based off of what we can observe, and not often are the two combined. So there's still some gaps there, but there is some that show relationships between the two. But to speak to your story about sort of the fear around the natural environment versus those who kind of seek it out or are drawn to it, that also gets at the comment about knowing what people's prior experiences are, but also choosing, exposure to and being in and being shut off from people and not being able to padlock those thoughts is one useful way to approach forest therapy. Using the setting as a more formal place for counseling and intentionally exposing people to social interactions and to therapeutic practices is sort of another way of looking at it. So I sort of see there being two levels, I suppose, of therapeutic engagement with nature and forest. One is sort of passive, that you're letting it act on you. It provides the privacy, the solitude, etc. And then there's using the setting to engage in other therapies with potentially added positive benefits. Yes?
You talked about the effects, a lot of the effects of being in the forest, but is there any data on why that works? Why being in the forest versus just generally nature or meadow or something seems to be more effective?
Yeah, that's a really good question. No, there's not a lot of formal research on that gradient, like what type of nature works, why are forests, particularly if they are beneficial for people. The sort of anecdata, I call it, around the topic is largely to do with forests convey a sense of wildness, back to the topic of sort of are humans conquering nature, than do a lot of other forested settings. Deserts kind of have that same feel of the true expansive wilderness that we lose control. We intentionally give up control in the presence of forests. Obviously, there are many forests that are intensely managed, as maybe some of you know, but even when they are intensely managed, they still aesthetically appear to be wild. So that's been what's kind of put forth as a possible reason. The other being that solitude and privacy, that trees, because they're so close and often so dense, shield people from other people and built infrastructure. So whereas in more open, wetland, grassland type environments, you can see much further, which is another reason that this hasn't been done quite as often in desert settings. Forests give you that immediate reality of privacy and solitude.
Just
that's all we
curious,
got.
is it easier on people with agoraphobia to be in a forest versus, I mean, they don't.
I don't know. I have not looked.
The more dense, the more sheltering it was, the terrain seems like that might be.
Versus Iowa.
Yeah,
Yeah.
the cornfield has the.
Or acre.
Yeah.
I've also heard, and correct me if I'm wrong, that sometimes being in a forest is not as visually, I don't want to say visually stimulating, but visually bombarding as being as, for example, in an urban area and having to be aware of so many more moving parts in an urban area and cues to be aware of, that in a forest you can relax a little bit more. Not always, but that's something that I've heard.
Well, and I think different cues too, because if, people will comment when they do the really slow walk or they sit in the woods, just how many cues they're actually receiving that they never paid attention to, but I think it's the change that's important. So if you're used to, do I hear a car horn, does that mean I shouldn't cross the road? Am I hungry? Is that a convenience store I like, etc.? All of those cues are very different than this is a bird call. So I think partly it's just the change you experience in these settings. Yep.
There's also that fun off of the corner sense of trees having spirits. I mean, the movie, the Avatar, that blue people. I mean, there is something to be said for a tree. My favorite place is Muir Woods, where the trees are 2,000 years old. But, damn it, they have their own spirits in a sense. There is something, whatever you call it Zen, mystical, or just loony, but those trees have presence here before any of those crazy wars happened. And from that, there's this sense of, and I'm not talking about the 10-year-old saplings in the backyard. I'm talking about trees, there's woods. They have withstood and will withstand another 100 years or another 1,000 years. I mean, the tree that is named Independence because they figured this particular tree started growing in 1776. That tree's only this big around, as opposed to the Muir Woods trees. So that tree has been there through that many upsets, wars, famine, whatever. It's going to be there a while longer. And there is therapy in that sense that I'm a speck out here in the Milky Way versus this, which is substantial, real, and enduring. And there's a therapy in that.
Oh yeah, well, and permanence and stability are two commonly associated feelings with woods that often, if you're struggling with something, are helpful feelings for you to feel stable.
You can't measure that. That's not something you put on a graph or a chart. That's where we come into trouble. But you can't really quantify that kind of effect.
Yeah, no, absolutely. And as much as I've emphasized the need for these clinical trials and sort of conforming to our need for quantitative scientific evidence, there's definitely an understanding that the benefits may be intangible, and so the best we can do are come up with some proxies for what we all kind of know we feel, unless we're anxious in the woods, obviously.